Hey, Dr. Clayton Roach here from Roach Chiropractic Center. Today we're talking about hip pain relief exercises for problems that are associated with that hip. I want to clarify, when we're talking about the hip, we're not talking about the sacroiliac joint. Many times patients will get that wrong. They'll say my hip hurts and they point to a spot in their lower back on the right and the left. That's actually the sacroiliac joint. We're talking about the actual hip joint right on the side here. And there's different things that can create pain in the hip. It can be from the actual joint, which is a ball and socket, or it can be from the soft tissues that surround that joint, like the bursa, the ligaments, the tendons, and all the muscles that allow you to move that hip joint in various different ranges of motion. So let's talk about the actual hip. How would you have pain inside the hip that would be associated with the actual joint? Well, we have something called degeneration, osteoarthritis. How does that come about? Well, you can have trauma, you can have repetitive stuff that you've done your entire life that creates a grinding in that same direction all the time. There's a ligament inside that joint, and when that starts to wear, it doesn't always wear symmetrically. So now you've got the ball inside that socket rotating asymmetrically that starts to grind at the top of that hip joint. And what happens when bone gets disturbed, it starts to build more bone. So now you have bone spurs that hang down in that socket, and now the ball is bumping against it. And many times, a lot of those patients end up with a hip replacement because nothing else can be done except, building another hip. Not a great scenario, and many times we could have done something in the past to help mitigate that. The other cause of pain can be from the soft tissues, like I mentioned, that surround that hip that allow you to get the range of motion that you want it to do, right? So we have muscles that open up the hip, muscles that close the hip, muscles that bring the leg out, bring the leg in. And what happens if those muscles don't work in concert and aren't symmetrical in terms of the length of those muscles, you're gonna have movement that's going to be asymmetrical. In other words, if you had a telephone pole and you had guy wires that weren't pulling symmetrically, that telephone pole is going to lean onto one side. So same thing with the hip. If you've got muscles that are external rotators that are tighter than the internal rotators, then you're not going to glide properly. And over time, you're going to wear and tear that joint, creating degeneration and potentially a hip joint replacement. So what I want to go through in this video are hip pain relief exercises that you can do every morning and every evening if you want, and that'll actually create better symmetry in that joint and hopefully give you hip pain relief. So here we go with some of those exercises. So here we go with the first hip relief exercise. So if you're having pain in your hips, this may solve your issue. You might have seen this before. It's called a 90-90 hip opener exercise. You can call it whatever you want. Basically what happens, you are activating both internal and external rotators of the hip. They work in concert with one another, and you're doing it simultaneously. So you're gonna sit up, you're gonna put your hands on the floor right here, and you're bringing the hip into internal rotation here and external rotation over here. And you do it on both sides. Right? So simultaneously you're going into hip internal and external rotation, and you're going to do 10 of these. Bear in mind, the taller you are, the more upright you are in the sitting position, the harder it's going to be. So do a little body scan, see where your hips are at that morning or in the evening, and then adjust accordingly based on your sitting position to make it either easier or harder. Do 10 of these on both sides. This one here, you're going to be in a 90-90 position. So basically the knee is at 90 degrees, this knee is at 90 degrees, and you're going to lean forward. Now to do that, you're going to turn your hips, lean forward, and what you're going to do next is what a lot of people don't do when they do this stretch. They just basically lean forward, kind of like a yoga stretch. What you want to do is you want to push that knee towards the floor for 5 seconds. 5, 4, 3, 2, 1. Place your hand on the knee and push against your hand. So your hand is pushing the knee down while your knee is pushing up towards the ceiling. Do that for 5 seconds. Once you're done doing that, you're going to lean forward a little bit more. Don't round your back, lean forward with your chest and do it again. Push against the floor, push against your hand, and do it one more time by going forward. So you're going forward 3 times and you do it on both sides. So then you flip 90-90, knee pushes against the floor, pushes against your hand, 5 seconds each. Go further and do that 3 times. This will help relieve some of the pain you're having in your hips. For this one here, you're going to be in that same position that we're often in to help do these exercises that are going to target the hip internal and external rotators to bring more balance in your hip. For this one, you're going to lean forward while the hip is at 90 degrees here, the knee is at 90 degrees here at the hip, and 90 degrees at the knee. You're going to lean forward, and what you're going to do next is you're going to lift this leg into hip internal rotation. And what you're going to do is you're going to lift it up, count to 3, 1, 2, 3, and release. And you can kind of come out of that bend you're in, go back down, and you're going to bring the leg up for 3 seconds, 2, 1, bring back. You may feel a little bit of cramping in that muscle. What that's telling us is that you actually need this stretch. Go back into it. 1, 2, 3, relieve it. I would do this 5 times on both sides. So then you just switch over, come here, you bend forward, and you lift the leg into internal rotation, or the hip into internal rotation. And again, you count to 3 seconds, and you do that 5 times on both sides. This will help promote hip internal rotation, which many of you are lacking, which is why you're getting hip pain and you can't get rid of it. So get doing these stretches and you're gonna see relief in that hip. Here's a great exercise for you guys that have hip pain, specifically groin pain, which can be a referral from the hip. What you're going to do is you're going to pin that knee down to the floor right here, and then you're gonna bring the hip here as far as you can. You're gonna hold it for 3 seconds, 1, 2, 3, bring it back and open it up. So feel free to take your elbow, grab your calf here, your ankle with your hand and push. Make sure you're not slouching. Sit up nice and tall and push out this way. Hold it for 3 seconds, and I would do this 5 times on both sides. So now we're switching over. Knee is pinned down to the ground. You grab your ankle with this hand and you're opening up this hip over here. Make sure the knee stays here and doesn't come up. Sit up nice and tall. 1, 2, 3, and relax. Push it out this way again. 1, 2, 3. And now you're gonna do that 5 times on both sides. If you want, after you've done that stretch, put both feet together, knees are out, and just do a little bit of a butterfly here just to bring blood flow back to the hip. If you're having hip pain, this stretch is going to help you get relief from that hip pain. Whether you're an elderly woman or man, young athlete, this exercise brings your hip in a direction that we don't bring it into too much during the course of a day. So you're going to be on all 4 in the quadruped position. What you're going to do is you're going to bring the hip out, turn, and you're going to bring it forward and lean into it. Bring it back in the opposite pattern. Out, turn, in, lean. Feel that stretch in your groin. Now you come out of it in the opposite pattern, and again, you do this. And you're gonna do this 5 times on both sides. So again, on the other side, you're abducting, you bring the hip out, externally rotate, bring it in, and lean into it. Do the opposite. Bring the leg out into internal rotation, out, and back to the quadruped position, out, in, lean, and you're gonna feel that stretch in that groin. Some of you may have a hard time doing this, okay? So again, this is not something that's gonna get better overnight, but if you don't use it, you lose it. So hip pain relief exercises. I'm Dr. Clayton Roach from Roach Chiropractic Center. Get going with these stretches and you'll see some relief in that hip.